Hi, friends. Thank you for joining us today. I'm Kelly Bristol. I'm the Vice President of Business Development at Just Gotta Have It, but I'm also the co-founder of Reps Are Local too. And we are so fortunate to have created a relationship with the International Home Furnishings Representatives Association, which has been around a long time. Um, to forge this relationship for the benefit of our side of the industry. So I'm going to introduce Steve Allegrezza, the Executive Director of IHFRA, to you so he can tell you a little bit more about IHFRA and its programs, and then you can hear from Tish. So thank you,
Wonderful.
Steve.
No, thank you so much, Kelly, and thank you everyone for making some time on a Friday to sit down and join us. I apologize in advance. It's perfect for this call. I've got a really bad sinus infection, so my voice kind of sucks today. So I apologize. But again, thank you so much for joining. It's great to have everyone here today. For those of you who are new to us, IHFRA, like Kelly said, is the International Home Furnishings Representatives Association. We're a 501c6 trade association, more on the traditional home furnishing side. So we're sort of kissing cousins, I guess you could say. You know, we attend most of the same markets. We're in Atlanta, we're in Las Vegas, we're in High Point. Um, we've been around for 91 years, and our job is really to empower reps with the tools, resources, benefits, and advocacy that they need to be successful today. I had the privilege of meeting Kelly and Angela, and quite frankly, many of you late last year, learning a little bit about the Atlanta market, learning a little bit about Reps Are Local too, and we had a great conversation about the pain points that the gift reps were having. And we quickly identified that there was so much overlap between home furnishings reps and really just gift and home reps. So we really came together to just, we have the same goals, which is really to support and empower the rep community. So this partnership was really just a no-brainer. So today I'm going to take just 2 minutes before we start talking about our health insurance offering to just give you guys like a quick overview of IHFRA and some of the other benefits and things that come along with it. I'm going to share my screen very quickly and just I've got a generic slide that I've made. So again, who we are, we've been around 91 years. And again, we have a very, very simple mission. We're dedicated to empowering, supporting, and advocating for our members in the home furnishings industry. We do this through a lot of different ways. We have networking that we offer. We do events really at all major trade shows. We have really a very robust benefits package and offering that goes way beyond health insurance. And then we have a ton of like other resources that we make available on a very regular basis. We have a lapel pin that you can wear to any and more trade show. It gets you kind of VIP access. You do not have to. That's a little easier to see. So we have a lapel pin that really it grants you access to any of the 3 and more shows. So Atlanta, Las Vegas, and High Point. You can walk right in the door and not have to worry about having a physical badge or paying to register to attend shows if you're in that position. And we also have a ton of savings programs. So just beyond the insurance, I really just wanted to hit a few that are very beneficial for a lot of our members. The first one being print and copy services. We have really substantial discounts through Staples, Office Depot, and Vistaprint. So anything from like your business cards to heavy duty marketing materials is where we get all of our signage printed. And it's typically, I would say for most print and copy jobs, we save our members about 40 to 60%. So if you do a lot of printing, that's definitely something that will benefit you greatly throughout the year. Travel and leisure, we have a great program and a partnership with a company called Engine. And that unlocks, they say, up to 26% off of retail hotel pricing. It's good for hotels, rental cars, and flights. Truth be told, maybe 26% may not be every single time, but I've never not saved money using our benefit program. And you can plug in all your frequent flyer miles, all your hotel rewards points, and you get 4% back with the engine program that we have a partnership with. So you're getting 4% back on top of the discounts, and you're still getting all of your hotel and frequent flyer miles and all that good stuff. We do have some technology and office supply discounts, again, through Staples, Office Depot, but Best Buy, GE, Lenovo. We have programs both with FedEx and UPS. There's another one in there called Freight Pal. And then we do have some, I'm a little hesitant to even go into the cell phone discounts because they're a little bit hit or miss as of late. But we do have some programs there that can save you at least a little bit of money on adding new lines, things like that. And the next piece of it here is, and this will be a good turning point because I'll give it over to Tish here in a minute. But we do have some really, really tremendous insurance and HR benefits. So we do have health and supplemental insurance. Tish is going to talk about that here more in just a minute. We have a really great liability insurance partner. It's the Home Furnishings Insurance Group. And then we also have some third-party partners that offer home, auto, and pet insurance. We do webinars every single month. We provide a monthly newsletter. We have one of the big things that we are known for on the home furnishings industry is we have this thing called the Opportunity Center. It's a member-only job board. So this week, in 2 hours, we do it every Friday at 5:15. We've got about 15 territories that are open. So we're promoting those open roles to all of our members every single Friday, 5:15. So you can apply for jobs, you can post a job. It's just another great way that we try to be a connector on our side of the industry. And this partnership with Reps for Local 2 is a great example of how we want to be connectors to the whole industry. We do have local chapters. We have, again, events every single market. We have an annual Furniture Industry Awards Gala that brings together kind of the C-suites of the home furnishings industry. We do that every year. It's an amazing networking event. We do some peer recognition through our All-Stars Award every April. So again, I believe, I'm not even going to the joining IHFRA piece. Our information is here. I'll put my information in the chat here in a minute. We've set up a special program with Reps or Local 2. And actually, if you go to the Reps or Local 2 website, you can join through that link, and that will get you in at a discounted rate of $99. And that will also allow me to provide a discounted rate for the Reps or Local 2 members in perpetuity. So with that, I'm going to stop sharing my screen and really get into the meat and potatoes of why everyone is here today, because we know that health coverage is one of the biggest challenges for independent reps. It's one of our highest expenses, and that's why we're really excited to bring you today's session. We're very fortunate to work with an expert who has helped hundreds of reps navigate their options and find affordable health insurance, myself included. So with that, I'd like to introduce Tish Zitzow. She's the Vice President and Account Executive with Woodforest Insurance Partners. She's one of IHFRA's vendor partners, and she has been an exceptional resource to our community, and I'm confident she can help you out with any health insurance questions or issues. Anyway, these are things that will be available to all Gift and Home reps through this partnership with Reps or Local 2. So I'm going to stop rambling now and turn it over to Tish. Um, and Tish, thank you for being here. The floor is yours.
All right. Hi, everybody. Thank you so much for joining us. Please, forgive me if I lose my breath as we're talking. I've been talking to a lot of people. This open enrollment has been quite the challenge. I want to go ahead first off and say thanks, Steve and Kelly, for getting me in front of you guys. I appreciate you guys taking time. It's been a lot, but we wanted to get this going, and timing wise, obviously it worked out great. So the way I want to kind of talk through some things first is I like to kind of educate first and foremost. And when I say educate, pretty much let's just talk about what's going on. Okay. So quit listening to the media. All right. I want to talk about that first, because the media is out there portraying that all the subsidies are gone for the ACA. It is absolutely not the truth. What they are fighting about and what they can't get their act together about are the COVID era extended subsidies. Okay. So during the Biden administration between 21 and 2024, they extended those APTC, those advanced premium tax credits is what that's called, for COVID. So we had people that were making $200,000 and $250,000 a year getting subsidies. So they're trying to take those back away and put them back for what those subsidies are meant for those people that, have that lower income. So if that is you, please make sure, if you have had subsidies in the past and you think you might be marginal, I encourage you to still go to healthcare.gov and look up and see if you are qualifying for a subsidy. You do not have to log in or anything. You can just put in your zip code, how many people in your family, dates of birth and such, and then put in what your household income is. Okay. Household income on the ACA, also known as Obamacare, also known as Marketplace. These are all the same thing. And then, depending on where you live, if you're in California, it's covered California. Georgia, it's Georgia Access. So depending on your state and what you have going on, it could be called something else, but they're all the same thing. They're all the same thing, but I encourage you to go in there because they're just the household income piece is your revenue, is your income less your business expenses, guys. So most of you are self-employed. There might be some of you that might be part of a team. But if you're self-employed, it's your revenue less expenses, that whatever you're paying taxes on. So make sure that that's what you're using. Do not in any way, shape, or form underestimate it so that you can go like, hey, I can pay cheap, because you'll pay all of it back at the end of the year, okay, when you do your taxes. So be cautious, but that is still very much an option there, depending on where you fit. The larger your family, the more money you can make and still get a subsidy. So I just don't want anyone to just say, I don't get subsidies anymore because they're gone. That's so not true. So if you have qualified for them in the past, at least look at what it's going to look like for you before you make any decisions. The ACA, Marketplace, Obamacare, the open enrollment for January 1 is December 15th. So you'll need to make that decision before then. Our open enrollment, however, is the 18th of the month. So we have a little bit of extra time than we do on the other one. The other piece that I really like to talk about is that we can enroll all year long. Okay. So by the 18th of any month, we can go on the first of the month. All right. So I really like to cover that because you may be watching this later and you may want to go like, hey, can I get health insurance in the middle of the year? Absolutely. We don't need a qualifying life event to come onto these plans. Once you're on the plans, you do have to have a QLE. That's what a qualifying life event is. Divorce, marriage. I put divorce first. That's crazy. Marriage, divorce, new babies. You're moved out of state, all of those things. On the moving stuff, it doesn't affect us. That is on the ACA only. Moving stuff doesn't affect us because these are national plans. So that's not going to matter for y'all. These will work in all 50 states. But I really, really like to go over the negative part first. So that way, I'm being very, I just want to be transparent and not waste anybody's time. Okay. So I hate talking about negatives, but I want everybody to just kind of understand where we are. And so you can make those decisions and not stick on if it doesn't apply to you. So I'm going to be going through several different screens, but the first thing I'm going to talk about right here, don't pay attention to the plan designs. We'll talk about them in a minute. But on our enrollment, here are the states and Virgin Islands and all that stuff that we cannot bind coverage. What that means is your state legislature will not allow to have this kind of plan in your state. So Alaska, Hawaii, Maryland, Minnesota, New Hampshire, Oregon, Vermont, and Washington. So there's a whole lot more there, but those are the Virgin Islands and Puerto Rico and all that stuff. So if you live in one of those 7 states, I'm sorry. Your state probably has expanded Medicaid anyway, which means you probably have additional state subsidies that might be available to you. But unfortunately, your government doesn't allow it. So we can't help you there. And I'm sorry. That's kind of the program, and it's outside of our control, and it's outside of really the insurance company's control. It's all based on your Department of Insurance. So I want to go ahead and get that out of the way. So now that we've talked about that piece, so that if that applies to anyone, you don't have to waste your time. The other piece that we're going to talk about are the suitability requirements. This is a big one because I do not want you waiting to enroll if we get that little extra window if you're not going to qualify. That's the last thing I want to have happen to you, is you not to have coverage. These plans are, they are under a group health plan, but they do have qualifying, questions that we do have to answer as a no. I'm not going to read them for you, but these are what they look like. If anyone in the next 12 months, you need an organ transplant, if you're in kidney failure, if you're hemophiliac, if you're already pregnant, have that baby and then come to us, okay? We can't put you on the plan if you are pregnant, but we can absolutely put you on the plan after you have that baby. Or if you're on the plan and then you get pregnant, you're fine. And then if you're seeking infertility services, you need to stick with whatever plan you have, because that's going to be the only way you're going to get those fertility services paid for. Last 5-year look back. This is the big one. Cancer, heart disease. If you have high blood pressure and high cholesterol, so does everybody else. So don't worry about that at all. But if you've had bypass, if you have stents, all those kind of things, stick with what you have. If you've been homebound or incapacitated due to a medical condition, then this isn't a good plan for you. Autoimmune diseases, HIV, AIDS, lupus, MS, those kind of big ones, those are also knockout questions. If you're an organ failure and organ support, again, you want continuity of care, stick with what you have. If you've been hospitalized or had surgery in the past 5 years and you're still doing follow-up, or you're still taking medication, or you're still seeing your doctor for it, that is a pass. You cannot get past that 5 years. So if you were hospitalized 5 years ago, but you're still taking a certain drug for it, sorry, I apologize, but that's a knockout. Respiratory disorders, COPD, emphysema, chronic bronchitis, or chronic pneumonia. Here's the last big one, is the back disorder. If you're getting spine injections, if you're getting anything like that, you need to stick exactly where you're at. Substance abuse and dependency, we absolutely, first off, we'll pray for you. And second off, that's a knockout. And the type 1 diabetes and Parkinson's, epilepsy, the big stuff. That's what we're talking about, is the big stuff. And then this one, I just kind of skipped over. If you already have surgery suggested or planned, stick with what you have, and then we can talk afterwards. So those are kind of the qualifying things that I like to get out of the way. If you think in any way, shape, or form that you're like, man, I don't know, I can't answer this question, my information will be sent out where you'll have my email address. Just shoot me an email and I can tell you real quick, where you fit. And if I don't know the answer, if it's vague even for me, I will absolutely ask on your behalf and find out so that you know. But once you're on these plans, there are no pre-existing condition waiting periods or exclusions. So that means everything is covered day one. So from the date you enroll until whenever you cancel, everything that happens in that is unlimited. These plans are ACA compliant when it comes to the benefits. Okay. What does that mean? It has all your 10 essential benefits, your preventative care, it covers, it's unlimited in nature once you're on the plan, that, there is no annual or lifetime max on these plans. And then all the other pieces, and we'll go over those greater details. But I really just don't like anyone wasting their time. So if you're still here, then let's get going. Okay. So You guys will get your own page like this. All right. It's just, we did this all last minute, right time when open enrollment started. I think that Kelly started getting a lot of calls going, oh my gosh, what are we going to do? And so we got all of your plans put together, but I haven't got your technology done yet. But this sits behind, if you're a member of IHFRA, you can get on this from your IHFRA website as well. It is only located behind the scenes after you log into your association. But I'm going to just high level cover these things real quick, and then we're going to talk about the health plans. If you're a member of IHFRA, you get the ability to have a free estate planning service. It gives you, it's about you can get it done very easily as you have time. It's online and it's free. If you choose to upgrade and you want to talk to an attorney and have them, those are very discounted services. But it is a great program. I hate talking about death, but myself, I lost my father a couple years ago, and as much as I love him, pain in the ass that he did not have anything set up. And I was very angry with him after he passed away, because it left all of it on me. So if you do nothing else today or do anything else, think about that. And if you have kids, you don't want to leave that burden on your kids. It's free. Get it done. It's so easy. All right. This here is an additional ancillary supplemental plan. This has no medical conditions, and you can cover your family for $79.95 a month. One person or anybody in the household, it doesn't matter. You can cover them for $79.95. Let me slow down. $79.95 for your family in all 50 states. But some of the states do not include the additional insurance piece. And when you get access to this, you'll be able to click and see if it's your state. But if you are in an insurance state, it comes with $10,000 of accident coverage per occurrence, not per year. It has free telemedicine. It has your preventative drugs at zero cost. It has $7 lab fees. And then it has some additional vision and dental discounts and stuff like that. So it's a good supplement filler. It's also, for people who can't afford anything and they're not getting any help on the marketplace, it's a good stopgap until either you can afford it or, until you want to do something else. Okay. So that is an option. There are no deadlines for that. So if you get through this process and you start, comparing everything and you're just like, none of these fit my budget right now, this is an easy one. You can get it 5 days after you go effective. And again, it'll at least cover some of those basics for you and then give you discounted imaging and discounted, other pieces. So at least it would be a good starting point to keep you from not having anything at all. Okay. So that kind of covers the extras. When it comes to vision and dental, that's flashing here at the bottom, vision and dental is based on where you live. Okay. So it's going to be based on your age and based on where you live. Those things, we can send you a quote from either Cigna, United Healthcare, or Delta Dental, and Delta Dental shares the spotlight with VSP for the vision. So those things, do not have open enrollment. We can do those at any time. But those things are available to you as well, but those are going to be independent of the group health plans that we have today. So if you do get, if you do join and you see this, if you click on any of these policies, that's what that was, it's going to pull up that summary plan document that we're going to go over in just a minute, that I'm going to show you how to read. But they are all available right here on the plans that we go over on your Membership Plus website. Okay. So we will be able to give this. I think Kelly's probably sent some of this information out to everybody already, but they are online and we do try and keep them up to date. We just got all of the 2026 loaded about 4 weeks ago. So they won't change for the year. So at least we got that out of the way, but then we'll get you guys as reps are local too. We'll get those set up as well. All right. So let's get into the bread and butter now that we're done with housekeeping. We have 4 different plan types. We're going to start first and foremost with HSA plans. What is an HSA insurance plan? An HSA insurance plan allows you to have an HSA savings account that you are able to put money back that is tax-free to pay for your medical needs. Now, it means you have to have a high deductible plan to have an HSA account. Okay. And so our high deductible plans are $3,500, $5,000, and $8,300. Now we have some major medical PPO plans that also have high deductibles, but because they have a copay, they don't qualify for an HSA. So an HSA does not cover anything but preventative care and telemedicine until you hit that deductible, because that money that you're putting back tax-free is meant to pay those things, including like copays and such like that. But we'll quickly talk about this. Just so you'll know, as we go through this, every one of these are going to look the exact same because I've laid them out exactly the same for every one of them, so they're easy to find. Everybody has the cover sheet of what the plans are, and then on page 6 on every one of them, it shows your pricing, and then all the plan design is in between. So we're going to high level go over this one, and then we'll go on to the other ones, because this one is really meant for those that financial advisors told you to get an HSA. So not as many people go with this, but I'm just going to high level go over it. The one thing about the HSA plans is they are going to have a lower out-of-pocket max than the PPO plans. The EPO plans were okay, but the PPO plans are $10,160. All right, so how these plans read, these are your deductibles, and this means in-network, and this means out-of-network. So on our PPO plans and our HSA plans, you have in-network and out-of-network benefits. That means if you can't find your doctor in network, then you can go out of network, but you will have to, it's a new deductible here, and then it's a different coinsurance. So I like to go back and talk about what's a deductible, what's coinsurance, and what's an out-of-pocket max. First and foremost, your deductible is you have to hit your deductible, meaning you're paying out of pocket the contracted rate up to your deductible. What does that mean to you? Let's talk about wholesale and retail. It's easier for us to talk about wholesale and retail. It makes a little bit more sense. So if any of you have ever been to the hospital or been to a doctor or anything of that nature, and they send it in, you get the bill afterwards, and it says, okay, it was $10,000. Insurance adjusted amount, now it's $2,000, right? So we're talking retail and wholesale. So in a $3,500 deductible environment, you as the policyholder will be responsible for 100% of the wholesale contracted rate up to your deductible. Then between deductible and out-of-pocket max, you are responsible for 20% in network, and the insurance company pays 80%. Out of network, you're responsible for 50%, and the insurance company pays 50%. Once you hit your out-of-pocket max, okay, that means everything, including your deductible and everything. But once you hit out-of-pocket max, which is this number here, 8,500 individual, 17,000 family. So whether you have one person or 4 people, it's still the same family out of pocket. Once you hit that, then they pay 100%. So you are 100% of wholesale. You guys share from deductible to out of pocket, meaning coinsurance. They pay 80, you pay 20, and then they pay 100% of the wholesale price after that. Okay, so that's how a PPO, or that's how deductibles work. Now, these again plans are true PPOs. What's a PPO? A PPO means you can go in and out of network and still have benefits. And network means, was it Cigna, whether it's United or whatever. We offer Cigna and PHCS, which is a smaller network. I'm going to encourage all of you, depending on where you live, most likely Cigna is going to be best, especially if you are in California or in the far Northeast. You absolutely need to pick Cigna just from a network standpoint. But we'll go over that. Oh, I love that, Steve. Love that girl. That was okay. I love her. Anyway, so that's how, kind of the plans work. And so in and out of network, as you can see, once you hit your deductible, your plan does have a suggested copay of $40 for your primary, $75 for a specialist, $90 for urgent care, and then $75 for chiro. Okay, so again, that's after you hit deductible. These are just the HSA plans. So again, everything except for preventative care and telemedicine is after deductible. So let's just jump down. As you can see, it's just going to kind of cover how your preventative is, all your therapy, organ transplants. It's really your summary plan document. And then it talks about your drugs. Now, on all of the drug plans, so we all use ProAct on each one of the plans. That's the pharmacy benefit manager. And Maintenance drugs, high blood pressure, cholesterol, etc. If you want them covered by the plan, you need to do them by mail order. You get your first month retail while you get set up, and then everything else after that is by mail order. But then your generic drugs are $0. All right, so that's kind of nice. $0. Urgent needed care RX. What does that mean? I need antibiotics, or my kid has an ear infection and I need to get drops, or I've got the flu and I need Tamiflu. You can call telemedicine and tell them, hey, I got the flu. They will call in, or call in your prescription of, Tamiflu or whatever. And then you can go retail and just pick it up for $10. Okay. So retail for those day-to-day, maintenance needs is going to be mail order, but the things that just come up in life, those are going to be retail. I will tell you, no matter who you have, unless you have Aetna, stay as far away as you can from CVS. CVS and Aetna are partners, so they hook each other up and they kind of mess everybody else's up. So I always tell everybody that whether you're on these plans or not, avoid CVS if you can. All right, so there is a formulary, mail order formulary, and then the telehealth documentation and what they can do. Again, these are all on these forms. It's all on page 5 for every single plan. The one thing that I really want to cover right here is this specialty drugs. There are no specialty drugs covered under any of these plans. What is a specialty drug? A specialty drug are those fancy commercials that have those fancy drugs that have commercials. All right. Usually they run about $2,000 plus a month. So to keep our costs under control so we can afford these plans, they are not covered. However, we do have a patient assistant program available to help you get those and the manufacturer's copay plans, especially once you come on the plan. If you are diagnosed with something and you need one of those kind of drugs, we do have a program that help you work through those. But the one things that will not be covered: Mounjaro, Wegovy, Ozempic, Zepbound. Those are all weight loss drugs. Now, if Ozempic, if you're diabetic, absolutely, it's still not covered under the plan, but you can get them. I talk about those because I have people all the time calling me about those weight loss shots. Even the marketplace is starting to stop paying for them because they are so expensive and they're being used for, different diagnosis. So if you are in that kind of situation, I would kind of caution you to make any changes if you want to keep that covered, or go generic and buy the GLP-1 generic at a regular place. All right, so that kind of covers that. So let's just jump to the prices real quick, and then we'll go over to the other plans that I think will be a little bit more in tune. So each one of these have either a $3,500 deductible, $5,000 deductible, or $8,300. Again, all those plans were the exact same, but you pick your network and that's it. Pick your deductible, pick your network. So it's all age-based, so it doesn't matter where you live as long as you're not in those 7 states. These are the rates. We will always put the oldest person is how you need to calculate your prices. Okay, the oldest person. But we try and do our best to kind of manage that. If you're in your 60s, we want to be able to make sure that we manage you into Medicare properly. We do have a full Medicare team, so we can help you transition if you're getting into those age brackets. And we try and transition you about 3 months before and try and help you through that. If you listen to nothing else today, never put your information in on Facebook. Never fill out anything, whether it's for, healthcare.gov, whether it's for medicare.gov, any of that, because they sell your information and they sell them to people who live in the Philippines, and they'll never, ever leave you alone. They will bother you till you die. And when I mean till you die, my grandmother was on her deathbed and they were calling her. And I'm like, you got to be kidding me. Here's how you get out of it. If they keep calling you and calling you, tell them you're a health insurance agent. I promise you they'll hang up, because then they know they're not being compliant by calling you. So there's my little trick, my little TED talk for the day. So here's our pricing. So depending on where you are, let's just go with the 45 to 54. If you do PHCS, that's $584, and Cigna is $645. So you're paying about what, 45 plus 16, $60-ish more for the Cigna, but Cigna's network is a lot bigger. So there are five what we call the BUCAs, which have the biggest networks. Blue Cross is number 1, United is number 2, Cigna's number 3. And then Aetna, Humana go back and forth depending on who's going on for the year. So those are the big guys with the buying power. Everyone's heard of them. They're taking them in almost all places. So, that's Cigna. PHCS is a much smaller network. It does not work in California, and it does not work in the Northeast. But if we have a 26-year-old boy living in Mississippi, this is where he should go. PHCS, it's a smaller network, but it's fine. PHCS stands for Private Healthcare Systems. So I talked about the 5 BUCAs. Well, then we have everybody else after that. So there are like thousands of health insurance providers out there, but they need that same buying power to get those wholesale prices down. So they've all, what I like to call them a co-op, they've all kind of come together into a PHCS network. Now I'm going to show you the networks, and we're going to kind of do some lookups in a few minutes, but that's kind of the difference between PHCS and Cigna. I really try and encourage you to spend a little bit extra money. I get paid the same either way, so it doesn't matter to me. But if you want to be happy with your plan and you want to make sure that you have a great network, I highly encourage you to consider Cigna as your network, unless it's just not budget friendly. So again, these are the HSA plans, high deductible that you can have an HSA savings account with. So now we're going to talk about the PPO plans. The PPO plans, oops, didn't mean to do that one yet. Okay. The PPO plans, we have, these two are the exact same, all right? The only difference is these are the lower deductible PPOs, and these are the little bit higher deductible PPOs. If I had them all in the same document, you wouldn't be able to read them. It'd be too small. So they're all the exact same plans, guys. It's just picking your deductible and picking your network again. So I'm just going to kind of focus on this one because, again, the other deductible options are $1,000, $2,500, and $3,500. But I'm going to focus on the higher deductible plans for now, because, again, they're all the same and it's easier to kind of go over. Here we have your deductibles will still be at the top. Again, the formatting is the same on everything, so it just makes it really easy to understand. Your out-of-pocket max on these plans, on the PPO plans, are $10,150 and $20,300. The marketplace this year, the out-of-pocket max is like $10,500. So it's still less than the marketplace, also known as Affordable Care Act, also known as Obamacare. It's $10,500. So it's still a little bit less, but it is, those numbers are getting up there. Things that are covered, your regular colonoscopies, anything of those essential benefits, your mammograms, colonoscopies, well woman, well child, vaccinations, if you do that, those are all considered preventative care and not subject to deductible on any plan and covered at no charge. But as you can see, there are things that it doesn't cover: acupuncture. If you need children's dental or children's eye, that's a separate policy. So vision and dental is totally separate. This is 100% medical. All right, so let's talk specifically about your copays on these plans. Again, you do have in and out of network benefits, but these plans are unlimited. Again, meaning no annual max anything. So $25 copay for your primary, $40 copay for specialist. If you're seeking mental health treatment and they're in network, mental health is considered a primary care, so it's a $25 copay. So 25 copay primary, 40 for specialists, 60 for urgent care. And on the PPO plans, you get 24 chiropractic visits. So that's 2 per year at a $30 copay. Again, I told you telemedicine is free of charge on all the plans. My husband gets sick and coughs and hacks on me. So I always tell him, I shove the phone in his face and I'm like, would you please talk to the doctor? Okay, emergency services are 20% after deductible, meaning you go to the emergency room, you're paying, your deductible if you haven't met it yet, and then you're going to pay 20%. Labs are $25 copay and x-rays are $100 copay. I'm going to stop there for a minute because on your major medical plans on the marketplace, unless it is a zero deductible plan, 9 times out of 10 labs and x-rays are going to be towards your deductible, okay? But on our plans, they are copay based, so you're not going to get that $700 lab bill that they tend to be really good about sending you. Diagnostic testing, what's that mean? MRIs, CT scans, ultrasounds, those are after deductible. Outpatient, anything involving the hospital is going to be your 20% after deductible. Again, preventative care, we already covered at zero. Physical, any kind of physical therapy, occupational therapy, speech therapy, it's a $40 copay, and you get 30 days per plan year for those type. Pregnancy, 20%, but if you're in baby making mode, hold tight because we got a much better program. 20%, and as you can see, all of the, transplants covered, diabetic counseling, Durable medical equipment, that's going to be like wheelchairs, crutches, etc. As long as you stay in network, it's going to be 20%. If you go out of network, everything out of network, you have to hit that higher deductible, and then you have a higher out-of-pocket max, and then you have 50% coinsurance. So I'm telling you, do your best to stay in network, but you do have that option. But you pay to have the option. Okay, on this plan, again, we still have our same formulary, our same drug prep pattern, again, mail order. And now we're going to get back to the prices. So again, I'm encouraging Cigna as much as possible. And as you can see, the least expensive major medical plan for Cigna, I'm going to go again let's go to the highest one is $652. If you're 45 to 54, it's $620. And then 30 to 44, $596 and $582. And then you can just kind of tab out in your grid where you fit and where those prices would be. So again, those are major medical PPOs. PPO means you can go out of network and you can say in network, either one, but you do not have to have referrals. That's an HMO or a POS. And that POS doesn't stand for PSOS. It stands for point of service. So those give you out-of-network benefits, but they still require you to have a primary care physician. None of our plans fit that. All of our plans are, go to the doctor that you need. So there are no HMOs. But the plan I really want to talk about is an EPO. So this is an essential provider organization. So what does that mean? As long as you stay in network, your plan is covered. You do not have out-of-network benefits in an EPO environment unless it's a medical emergency. A medical emergency, heart attack, cancer, or no, cancer is not a medical emergency. You're going to be planning for that. But let's say you have a heart attack or you're in a car accident. You're going to be in an ambulance. You're not going to say, hey, let me check where I'm going to make sure that we go in network. By law, any kind of medical emergency, you must be treated as in network. It doesn't matter what insurance you have. This law went into effect about 3 years ago. It's called it's an act, No Surprises Act, where you cannot be charged out of network benefits or out of network fees for medical emergencies. Okay. So again, let's go back. The EPO allows you to go to any doctor. So if you break your arm, go straight to an orthopedist, as long as you stay in network. So it's kind of like I'm going to say the best of both worlds. And I say that because the pricing, that PO pricing is expensive because that's an unknown to the insurance company as to, well, we don't know where you're going to go and how much that's going to cost, right? So you pay for that luxury. I will tell you that like where I live or in the state of Texas and many states like Georgia do not even have EPO or PPO options. They are only HMOs. So this is, going to be a little bit more flexible as well. And the plans, like I said earlier, they work in all 50 states. So you guys are travelers, you're going places. So these plans will travel with you. Again, like I said, they're all set up the exact same. But here's what I want to show you. Now we're looking at $500 deductibles, $750, $1,000, and $1,500. Much more brain set in trying to figure out what those are. Now, here's the one caveat is you have to hit your deductible before you can have your copays and for things to kick in. Again, on this plan, telemedicine and preventative care is at no charge and therefore not subject to deductible, but you must hit your deductible before anything else comes in. But once you hit your deductible, everything on this plan is a copay. None of that 20% nonsense of, okay, 20% of, I don't know, right? So whatever that particular provider wants to charge you. Here, it's specifically a copay. So before we get into what those copays look like, let's talk about how that deductible works and then how it kicks in. So let's say January 2nd, you go to the doctor, you're going to go ahead and plop down your card and you're going to pay your $50 copay. All right. You're not going to worry about your deductible day one. They being your doctor, your hospital, whatever, they are going to submit their claim to the insurance company. The insurance company is going to price adjust it. So let's say they charged you $400 for that doctor's visit. Well, once it gets repriced, right? It's repriced now down to wholesale. That visit probably was $175, if that. Okay. So let's say $400 to $175. Well, you've already paid $50, right? So they're going to send the claim back to your provider, and then you're responsible for the difference. So if it got adjusted down, let's do easy math for me. Let's say it got adjusted down to $150 and you had already paid $50, then you owe $100 and you've hit $100 of your deductible. Hopefully that makes enough sense to kind of get how those deductibles work. But it's a $500 deductible individual and $1,000 for family. Whether you have 1 kid or 47 kids, it's still $1,000. Max out of pocket. So this one's a little bit middle of the road. It's in between the HSA and it's in between the PPO. And it's a $9,200 individual, $18,400. But again, this does not have out-of-network benefits. Now, again, all the plans on this program are the exact same. Each column, it's pick your deductible. There is no pick your network because all of these are Cigna. They are not offered in any other brand. It's the Cigna plan. Primary care, specialists, and urgent care are all $50 copays. Surgery performed in the office, we'll talk about outpatient surgery. Now, this depends. Now, if you're doing if you're having like a little skin tag removed, that's probably covered under your office visit, but it just depends on what you got going on when it comes to surgery and performed in the office. If something like that comes up and you kind of want to talk through that, please let us know, because I don't want you expecting to have to pay $2,500 to get, one little thing off your face burned off. Chiropractic care. So this one still involves chiropractic, but now we're at 12 visits versus the 24, but there are $50 copay. Therapies, now you have 16 visits and they're a $50 copay. So notice everything, $50, $50, $50. It's pretty easy to know what you're going to have to pay when you go out. Now, let's talk about the other stuff. Labs, 25, x-rays are 50. And I love this one. Now your MRIs, CT scans, ultrasounds are a $200 copay and you're done. Again, you don't have to worry about, a big giant deductible and then paying 20%. Now you've got a $200 copay. I got to go get an MRI. I'm going to pay my $200. So again, it comes back to ease, simplicity, and, knowing kind of what you're walking into if you decide to go to the doctor. A lot of people decide not to go to the doctor because they're afraid of what's going to happen after the fact. All right, ambulance, you have a $250 copay. I do always tell everybody, depending on where you live, you may be able to have free ambulance service where you live by paying like a couple of dollars extra on your water bill or your utility bill. Check it out where you live because it's worth it. Regardless of whether you have our plan or you have anybody's plan, having a free ambulance service is a great deal. But if you don't have that, then we absolutely have the $250 copay. And then hospitalization is a $2,500 copay. If you have surgery, it's a $2,500 copay, not per day, but per admission until you hit your max out of pocket. So God forbid you have to go to the hospital, 4 times this year. Well, the 4th time isn't going to cost you, hardly anything because you've already paid, that $7,500 so far. Okay. Not counting all the other testing and everything that probably got you there. So, keep that in mind that it's not $2,500 per time. But again, it goes back to, I don't know. It's not an unexpected. I know that if I go to the hospital and I get checked in, it's $2,500. All right. And then a lot of the facilities, let's say you don't have those $2,500 sitting out of your pocket, they will work with you on a copay plan. So always talk to them. If you are ever in an emergency room, if you're ever in the hospital, again, whether you're with me or not, always tell them that you can't afford to pay that day. All right. And they will work with you. They cannot deny you service ever. It's illegal. But they can't make you pay either. You can work on all that after the fact. Okay, guys. So if you're ever in that financial situation, don't panic. Just get your health taken care of and we'll deal with all the rest of it after the fact. Okay, surgery services. Again, this is that office visit. If you have something, it's a $250 see this outpatient right here. It says it's $2,500 copay for an office outpatient. That's going to be like bigger stuff. Again, when we're talking dermatologists, it's a whole different ball game. So we need to make sure, because you're not going to spend $2,500 just to get, a skin tag removed. But that is, that's there for outpatient services and everything. But dermatology works just a little bit different. And it's all based on your dermatologist. Okay. So I can't tell you exactly today what it would be. Your dermatologist, we will have to work with in those cases. Infusion injections. If you go in and get infusion, it's $250. Chemo, it's $250 per visit. Dialysis is $250. These are going to be outpatient labs, not your regular labs, but these are going to be if they're sending you, for chemo labs and those kind of things. Those will be $100 copay. Preventative care, like I said, is free. Now we're talking about them babies again. So if you're one of those folks, listen in. You can have a baby on this plan for $2,500. That is your total bundled price. That includes all of your pre-maternity or your maternity visits. And then covers your normal traditional delivery or C-section. And then covers any of your ultrasound, your medically necessary tests that you do, all of the testing that you do as a pregnant mom. That's all included in that $2,500 bundle price. There's not going to be an anesthesiologist that sends you some fake bill later that says, I'm not a network. It's a bundled price. Okay. So that means that's what you pay, and that's what you pay. So you can get the baby paid off before you have the baby and be done. All right. Home health care does have a few limits of 10 visits per year at $50 copay. Durable medical equipment, again, that's going to be crutches, wheelchairs, $50 copay. You need a new leg or a new arm, that's prosthetics, $50 copay. And then allergy shots and allergy testing, $25 copay and $50. So now, once again, we are back at the drug thing. Boy, it got really small, didn't it? Now we're back at the drug program. If we start getting into, our formularies kind of show us what we have and what's available to you. If you're taking generics, get them by mail order and get them for free, or you can go to if they're generic, like blood pressure, lisinopril, or, a statin or something, those are usually like $2 to $4 at Walmart. Okay. So I always tell everybody, if you don't want to mess with mail order on those generics, they're cheap cash, but that won't go towards your, out of pocket, but neither is $0, right? So it's not really going to negatively affect you if you really want to go to Walgreens or somebody like that. And again, these also still have those patient assistance programs available to help you get your copays and costs under control. Now we're going to talk about why I saved this one kind of for last. Pricing. These prices are going to be, these are amazing prices for having a major medical plan, especially depending on where you live. So here's where your grid works. Again, it's all using the Cigna network. And you just kind of pick your deductible and where you fit age-wise and how many people you want to cover. And it's pretty easy to understand the grid system. So that's how those work. Now, I closed one of them a minute ago, so give me 1 second because I want to show you. I want to show you one last thing. These are called visit limit plans. Now, these are not going to be what's called AC compliant, but they are going to still have your preventive, for free, and still have the same mail order program for your drugs. I say all that because these are considered visit limit, which is what makes them non-ACA compliant. They are limited benefits. And I'll come back and show you the limits, but I'm going to go first to the prices. Now you're look at the prices here. If you are really in a budgetary situation, this may be the fit for you. The only challenge is the only network available for this is PHCS. There are no other networks. So that's the big thing. So do not get this, do not do the visit limit plan in the Northeast or in California for any reason whatsoever. You can't use it. So these are going to be the best price, but they are also limits. So, and you cannot do the $250 unless you already are on the plan. They're not letting new business come in for $250. But again, they have the same deductibles, $500, $750, and $1,000 as the Cigna EPO does. And then everything on it is copay as well, but you're limited. So you are limited to 12 visits of chiropractic care, which is fine. But all the rest of them, you get a total of 10 visits per person per year at a $50 copay. So 10 visits, that's it per year. If you're super healthy and you're okay with that network, that may be just the right plan for you. But it is considered a visit limit plan. You get 3 labs per year. You get 3 diagnostic tests per year. And if you'll notice, these copays look very similar, right? Your emergency room, however, is a little bit different copays. They're a little bit less. Again, because these are visit limits, they've made them just a little bit smaller because your premium is a little bit smaller. Infusions are $100. You get 3 surgeries a year at $250. You'd have a 10-day limit on outpatient, and dialysis is not covered under these plans. Inpatient services is $1,000 copay, but you're limited to 2 surgeries inpatient and 10 days in the hospital. Preventive care, of course, is $0. 16 visits for therapy and maternity benefits. Now look at this. Now we can have a baby for $500 if you're good with that network. Okay. So we're really trying to get those budgets down. All right. So now that you know kind of how all this fit, and I know we're running out of time. So those are the 4 different plan designs. You have the HSA that we talked about, the PPO in and out of network plans where you have 2 networks available to you, the EPO, which is a Cigna plan that has the low deductibles, a national brand name, and have, incredible prices. And then you have this visit limit plan that is using PHCS, that is going to be the most economically priced premium out of all of them. Now, the last thing I want to go over before we get off of this call is how to look up your doctors. One of the things that always comes up is I don't really know what I'm looking at. All right. So if you want to see if your doctors are in network, we go to Cigna.com. It's that easy. You're going to go right here where it says find a doctor. Now, here's the big thing where everyone gets, concerned. Well, is it direct purchase? No. Employer or school. This is a group plan, remember? So this is where you're going. It's a group health plan. I'm going to pick Atlanta because I've been working the heck out of Georgia this week. Put in your zip code. And then if you want to put it by name, or you want to look and see your hospitals in your area, I will tell you, no matter where you live, stay away from Kaiser. Kaiser is not accepting this. They don't like anybody but Kaiser. So if you go to Kaiser, stick with your Kaiser plan, because these plans do not work at Kaiser. But they work at Johns Hopkins, the Mayo Clinic, the Cleveland Clinic, all those big ones, and most likely your local hospital. I looked up NYU. I've looked up all of those other ones, and they're all in network. Now, you're always going to continue as guest because you're not logging into Cigna. You don't have a Cigna plan. You're going to continue as guest. All right. And then it says continue without a plan. Always continue without a plan because, again, you're not getting a Cigna plan. You're having a group plan that uses the Cigna network. Okay. So now we can see there's 36 hospitals in Atlanta, and it shows me where they're located, and it gives me all of them. All right. If I wanted to look up someone specific, then I could look up by name. And if it kind of shows up in this list, if it shows up down here, that means they're in network. Okay. If you put it in and the name's not there, even in the search window, it's like, oh, that person's not there. They're not in network. Correct. If they're not showing up, they're not in network. But if they show up, they are absolutely in network and they accept the plan. Okay. So that's how you look up Cigna. PHCS has a multitude of names. Multiplan, Clarative is who just bought all of them. Okay. So they are actually the one that's managing all of these, plans. Find a provider. Now here's where it gets tricky. We want to see all these networks. These are all those co-op networks that I talked about. We're going to choose the PHCS logo on front of the card. Notice it's the top plan. Notice it's the very first one. It's the highest level of access networks for PHCS. So it's the best network if you're going to go that way. So we click that. The other thing I like to tell everybody is spell the name correctly. This is not Google. It is not smart. Where Cigna is smart, PHCS is not smart. So make sure you're spelling it right, because if you spell it wrong, it's not going to find it regardless. Okay. And again, if they show up after you've spelled it right and they show up in the list, then absolutely they are in network. If they don't show up, they're not in network. Okay. Finally, last but not least, what is the catch? Everyone wants to know what the catch is? Catch is you need to be an IHFRA member. I'm telling you, I've been an IHFRA member since I started working with these guys, which is right at the beginning of COVID. And I've been a member, and the FedEx UPS discount saved me about $50 to $100 a week. And I only ship a couple things. So I'm just going to tell you that right there alone is going to pay your membership. The other piece is, because this is a group health plan, we must prove that you are a working member of the group. So what does that mean? You have to fill out a couple of surveys a year. All right. The last survey that came out was, what's your gender? What state do you live in? And I think, do you have a dog or cat? I mean, that's literally what it is, because all we're trying to do is establish compliance that you are a working member of the program. So then you'll fill those surveys out, but that you do have to do it. All right. So you know that coming in, but they're very simple. And like I said, there was one all year long. All right. So it's not like you're doing this like every 2 weeks, but they'll pay you for them. So let's say you're having a tough time. they're $10 every time you answer one. So if you want to get some more money for Christmas, or you got birthdays coming up, man, go in and answer some of those easy surveys and you can make money because you do get paid for them. So I think, I tried to get it by 3:00, Steve. I did my best. I'm going to open it up. Let's see. I think we have a few questions. Let's see. Do you need to join IHFRA? You absolutely do. Oh, that's Kelly. Sorry, Kelly. All right. Was there any questions I need to answer? Yes, that's correct, Steve. You were right on the states. All right. Got it. Do you need to join IHFRA? Okay, so I think all the questions have been answered. Are there any other ones that I need to go over while you're on guys? All right, so let's talk about if you choose to move forward and you want to move forward. All right, we have until the 18th of the month to get you enrolled. The enrollment takes about 10 minutes. It may take 5 if it's just you, but 10 if it's your family. I have to have everyone's social security number for that call. I have to have your payment information for that call. Payment information, credit card or bank draft, no fees. So pick up what you want, get your points if you want to. And they charge you on the 15th of the month of every month for the following month's coverage. So even though we have till December 18th, it would be taken on December 15th or up to the 18th, depending on whichever is later in your enrollment. And then going forward, it'll be on the 15th. So January 15th, you'll be paying for February 1 and onward, and that's how it works. If you're on this plan, next year during open enrollment, you're just going to get an email that says, hey, you're in open enrollment. You can either keep your plan, sign off and be done, or you can renew new plans. Like this year, we have a lot of people that the Cigna plan is new. We have so many people going to that EPO plan because it's affordable. So you have that ability. And then, of course, as the year goes around, qualifying life events. Again, if you weren't on the plan, you didn't go through open enrollment, et cetera, we can sign you up at any time by the 18th of the month, as long as you hit those suitability questions. I did have a question earlier today is like, okay, so what if I signed up today and I'm in a car wreck tomorrow? The look back or where everything starts on what is it covered or not is the day of your enrollment. Okay. Even though you're not effective, your day of your enrollment. So if you enroll today, you're hit by a bus tomorrow, you're still covered under January 1. Okay. Let's see. What have I missed? I think, my calendar link is blocked and booked solid. So we have a high level of a quantity of appointments coming in coming into us. So we are manually adjusting our calendar. So my Calendly link is kind of shut off for open enrollment so that we can make sure we fit all of you guys in. So if you're interested in moving forward, shoot me an email. I guess I should give you that. I always have that. It is Tish Zitzow at woodforestinsurance.com, but let me pull it right back up real quick. You can shoot me a quick email saying you might be interested, or if you have questions, absolutely reach out. I am answering all those questions in between emails, in between calls, because they are back to back. But here is my contact information. We do not take texts on that line. Okay. So don't text it because we can't respond to it. It's a landline. But that is our contact information. If you're interested, you have questions, like I said, reach out to me, email me. And if you need a calendar spot, then we'll absolutely find a place for you to get you enrolled one way or another. Will you be sending out the presentation? Yes, this is being recorded, Julie. And again, if you are a member, I think Kelly might have it to send to everybody on this call. But if you're, once you're a member, all of that's available on that Membership Plus page that we looked at. Can I help you compare plans that you have? Normally, yes. There's no way I can do that between now and December 18th, just because it's a little bit, I can't get to it. However, if you go ahead and renew your current plan, we can always change you in January for February 1 if you need me to do that. Normally, I'll do it immediately, but I'm tapped as far as my bandwidth right now. I want to get everybody enrolled that can get enrolled, and we're right in the middle of open enrollment for everybody as well. So if that's something that you need, I'll absolutely do it, but we'll have to look at a February 1 effective date for you, which is possible. It's not a problem, but I'll need a little bit of extra time to be able to really do you justice. I don't ever like to rush through when I'm doing a comparison. It's really, it's not good for you. It's not good for me, but it's really not good for you. I want to really be able to do a deep dive, and I need to be able to spend a little bit of time with you on doing that. So I'll absolutely do it, but it'll have to be a February one. And Steve put all of the contact information, everything in the chat. Are there plans for employees of a small business? Yes. I mean, you can use this if you're an employer, you can use these. However, they're all still independent individual plans within the group. So you can absolutely pay for them on your side, but or we can do, if you have 5 or more employees, we may want to look at traditional group, because we do that. And if depending on the ages or whatever, anytime you're 5 or more employees, I always like to run it both ways for you. So then that way, that you've got what's best for your particular, group. We have, a group in Dallas that they just had their 6th employee. We ran everything through, and it was time to go ahead and change them to a traditional group because it was less expensive, because they're all in their 20s and 30s. So, that's something that we can do, and we absolutely will. Blake Goldenberg. Okay, so they don't accept the Cigna EPO, they only accept PPOs. It depends. A lot of times they think those EPO plans are from the marketplace. So you need to quantify if you call them, Blake, and you need to call them and you need to ask them. It's a group health plan for Cigna EPO. That might make a difference. They don't like those marketplace plans, okay, because they don't get paid anything and they don't work really well. So highly encourage you to call them back and tell them it's a group health plan. And then if they don't take the EPO, then of course we obviously have the PPO available if that works better, because the Cigna PPO, it's the exact same network. But if that's what they tell you and that's what they want to do, go by them. Don't go by me, because they run their own show and they run their rules. But no, I don't get that a lot, but sometimes that happens. Okay. I think I got all the questions answered. Steve, what else do I got to do?
Well, Tish, thank you. I think that pretty much covers everything. I do want to just throw a quick side note out there, because so many of our members are independent sales professionals. That's why that is really Tish's bread and butter, because she can sort of tailor a plan to you, for you, because there are so many options, which I know she threw a lot of information at you today. That's why we did record this. We will send out a copy of the recording to everybody. We did share some links in the chat with everything in there. If you are a rep team, rep agency, we do have other options that are separate, but we do work with a PEO. But there are some caveats there in order for your company to access the health insurance options through the PEO. You'd have to be set up as an S Corp or C Corp or LLC. You have to use their system to run payroll, things like that. It's not there aren't a ton of hurdles to jump through, but there are a few that can disqualify some folks, which is why so many people just create the plan for themselves or get the plan that they need through Tish. That's what I do personally as well, and we've had nothing but good luck. So I think we've got everything covered. Again, I've got all the links in the chat. We'll send out some additional follow-up information to everyone that was on the call and everyone who wasn't, that registered. But we are so grateful for you guys making some time today. We hope that through this partnership and collaboration with Reps Are Local 2, that we can hopefully help more reps, rep more effectively, more efficiently, reduce their costs. That's really what this is all about. So we wanted to make sure that we open up our membership to any rep that is in any way, shape, or form associated to the home industry, because we all share the same pain points and are in this together. So we want to really empower you and empower our community. So that's what this is all about. So again, thank you, Tish. Thanks for everyone who made some time today. And if there's anything that you guys need, we are here for you.
Yeah.
So
Thanks, everybody. It was really nice to meet any of you virtually. Thanks, Kelly. Thanks, Steve. I appreciate the opportunity to get to talk to everybody. And if I don't talk to you, I hope you all have a Merry Christmas, a Happy New Year, and all the happy holidays, depending on what you do. Happy Hanukkah. Love you all. And thank you so much, and have a very blessed weekend.